Good morning, my dear friends. I am Dr. Anil Garg, plastic, cosmetic and hair transplant surgeon. Today I am going to speak on best hair transplant in Indore. So we need to discuss 2 points. What is best hair transplant and how it is possible, or is it possible in Indore? These are the 2 things. So the best hair transplant, in one word, if someone wants for you, the best hair transplant is after hair transplant you feel happy. Or when you went for the hair transplant, you thought I should look like that, and when hair grows, you feel, yes, that's what I wanted. That's the best hair transplant for you. But there are other scientific criteria which makes the difference scientifically, aesthetically. We have to define what is the best. I have to tell you there are the 3 things. The combination of these things will make anything best hair transplant. One is the medication, another is the technique, and third is the art. Why medication? When you are talking of hair transplant, where does the role of medicine comes? Yes, my dear, there is a very, very important role of medicines in hair transplant. How I am going to explain you. See, the number of hair follicles, the grafts on the top of head which you have lost or which you are going to lose is 30,000. And the number of hair follicles which is supplied from the donor area is just 5, 6, 7,000. So there is a great difference between your demand and the supply. And this gap cannot be filled in this birth. So what you can do, this area on the top, whatever number of hairs you have today, you retain them. Whatever number of hair you have which are weak, thin, you are going to lose soon, you make them better. If you do that, then this demand, which is this much, will be reduced and the supply will make it further bigger. That is the importance of the medicine. If you don't take medicine, the total number of supply from the scalp donor area will be only the 25 to 30% of what you want. So if you want to make it 40%, 50%, make your existing hair better, retain them, and you see to it that you don't lose them in just near future. For that, medicines are essential. I am not going to talk today for this time about what the medicines are. Your doctor will give you the medicines, and that medicine you must continue. How long? As long as it is possible, or as long as your doctor advises you. Now the second thing I told is the technique. Technique includes 2 things: technology and the technicians, means the manpower behind the technology who are going to use them. The technique and technology in hair transplant is, they are the 2 basic technique. One is FUT, in which a strip from the back side of head is taken by giving a long linear incision, and the strip is dissected and follicles are separated and it is implanted. This is a very good technique, but only one limitation which you don't like is that there is a long linear cut which generally is not accepted by the society. Although there is nothing bad in it, the scar is being covered very well, but it is your choice. So this is the FUT. Second technique is FUE, in which you shave the head, you take out individual hair follicle and implant them. Means there is no long linear cut is given. This technique done by an experienced person is very good, safe. Now there is one more word which is coming nowadays, is the BHT, body hair transplant. As I said in my initial talk, their supply is limited from this donor area, scalp donor area, but their area other than scalp are beard, chest, abdomen and other parts of the body. You can take from them. That you to take by FUE, they also grow. So these hair can be taken, this is called as BHT. So basically these 2 techniques, FUT, FUE, FUE can be done from here and from beard and chest also. Now, what are the other things important in this is who is doing it? Is he experienced? Is he qualified? Is he updated? Does he go regularly to conferences? Does he read the subject? Does he see the journals? What is being done? What is going on all around the world? Or he has learned 20 years back and he is practicing that. That makes the difference. That makes the difference. So, your surgeon should be qualified, experienced, updated and academically oriented. These are the 4 things your surgeon should have. And just for your knowledge, the Rejuvenate Hair Transplant Surgeon Center has got 2 surgeons, which is Dr. Anil Garg, myself, and Dr. Seema Garg. We both are diplomate of American Board of Hair Restoration Surgery. We both are equally qualified and experienced. So we regularly go to conferences, do the research, write the paper. Now another thing is the role of technician is extremely important in hair restoration procedures. Some work in hair transplant is done independently by the technicians under the observation of the surgeon. So technicians also plays very important role in the hair transplant. At our center, all technicians are very senior. They are well qualified, trained and are working with us for almost more than 10 years. So they are delivering their duties scientifically and honestly.